Just to add to it, basically we know about tuberculosis, how harmful it is to human and the cause or the harm it to do to existence in no time. So NECA is willing to partner with you. Like you have our members here, like a few of them are here, but it doesn't go that way. So I will just clearly state how it is done in NECA. You send us a proposal, send us a detail of what exactly you want, or how you want the partnership to be, and then we talk about it in the larger house and maybe at a national association level, and then get back to you.
Okay,
so it's quite simple.
Every state, like
yes,
your activities. If you don't mind, just tell us about the body, because we would like to know how we can structure requests.
Okay, I think your members know much about us. Madam Informa, you already know about us because that's how they got us into this place. So, Nigeria Employers Consultative Association is basically an umbrella body for the private organization in Nigeria. So basically we interfere or we create this interaction between private organized company and the government. So having this interaction with you, it's a great one. And then if you follow up with what I just mentioned earlier, how to get our partnership into it, it's going to be a very simple one. Okay.
Yeah.
With the last speaker, but just an addition that I understand that business people, they would want to dwell more on what puts money in the pocket, right? Than what they will need to contribute to society. And so most of the time, when corporate social responsibility is mentioned, some smart industry players will want to shy away from that responsibility. However, we can localize it in a manner that dealing with community-based organizations and community leadership to identify, specific, maybe like we saw in some of the clips there. Some of those health centers are found in communities, and there are some kind of projects going on there that some companies are doing. So if they want to tie it through, maybe say community-based organizations, you can still run it. Whilst I agree that an umbrella body like the City Chamber of Commerce should also be involved. So that way we're able to reach out. But I think this is an issue that we should treat as an emergency. Okay.
That about a third of humanity, they have latent TB, that is TB infection. That's what is referring to, not TB disease. And if you have latent TB, like in the 60s and 70s, there were very few TB patients until in the 80s when HIV came. So people with latent TB started developing the disease. So the infection increased. So as long as you mentioned treatment, by the way, there are risk factors for TB infection becoming TB disease. Like you have HIV, like you have diseases that reduce the immunity, they're taking medications that reduce immunity, malnutrition, diabetes, yes. So if you have those risk factors, with your TB infection, you can go on to develop TB disease. Hope it's much clearer for you now. Okay. So,
say that it's a very welcome development where we can have, these international agencies coming to talk to us. It's a good strategy for dissemination and interaction, on specific programs like this. Now, on what we can do, as one of the leaders of the organized private sector, I'm sure you know that in Nigeria we have the Nigerian Association of Chambers of Commerce, which is the overall, and then here in Rivers State, we are the City Chambers of Commerce, and we can do a lot together. We partner with almost all the federal and state agencies in the state, and we've been carrying out partnership. We are aware that it's not only commitment of funds that you can actually put in when you have a very laudable program like this. We have in the past, in 2019, when the COVID was very severe, the Chambers of Commerce, did a lot. We partnered with the World Health Organization, the Ministry of Energy, Environment of the Rivers State Government, and we donated materials, several millions worth of materials were donated. And for this, it is good that we are trying to tame the spread, to ensure that it is curtailed, and if there's any way to reduce it in the society. Most of our organizations have their health departments, and so they wouldn't see it as a new thing. And normally the Port Harcourt Chamber of Commerce, Industry, Mines and Agriculture, we used to have our monthly, our quarterly, and our annual forums where our people, chief executive officers of our member organizations, will attend, and then they would be abreast of some of the things that we have scheduled for such forums. So I would say that the first thing that is needed to be done is sensitization. You have already started it well here. Now, how would you sensitize all members? We are well more than 10,000 here, and the more people are joining. Okay, so the first thing you can do is we can have a sort of sensitization exercise in one of our meetings. We invite the organization, even if it's not you, maybe you have your contact organization, they will come and let us, because why that has to be done. You will have the chief executive officers, managing directors of those big companies hear it. They will hear it. Even as you are maybe put it on radio, they will not hear. Yes. Because they don't have time to listen to radio, don't have time to watch television and all that. But when we ask them to gather, they will listen and hear. And so they are the people that will also give approvals for any support. So we need to firstly do sensitization. Outside this we have done, we could agree and maybe fix some time that we will address all the members of the Chambers of Commerce. Now,
so sorry sir, so because
about 3 presentations for that. And so we'll see if we can also accommodate this. Okay, and I think it's coming up in July. Okay, so maybe we'll just chat with you and see if we can then squeeze it in, because whatever program you have to do in July, by now you must have be prepared. So having said and giving examples of what we have done, the members of the chambers are ready. They are always ready to support this kind of projects. Now, not only those who are in the health sector, because you see, controlling this disease, because you don't even know those workers that they are infected. And so those who are thinking of good health of their workers would have to buy into it. And then if there are things that are needed to be committed to, why not? Our people, our members are capable of doing that. There are many other things we have already done. So this one that has to do with the health, we don't joke with it. And I'm sure that when we carry out that sensitization exercise, then there will be, of course, if you are there that day, you hear them say it, because they'll be ready to actually support your program. Thank you.
We're a civil engineering firm. We deal with infrastructures. and structures, but issues like this come in when you are doing CSR. In Akwa Ibom State, my company is known for free medical outreach. That's a major part of our CSR, apart from the ones we do as an obligation to our host communities. We had our 10th edition on 12th to 16th of February this year in the whole of our federal constituency. It consists of 5 local government areas. And we do general cases with even complicated cases such as surgery, myomectomy. It costs relatively 500,000 naira in hospitals to have that surgery. And we have multiple of such cases, not just that, but a couple of them. So we're talking about millions of naira. And then we do it partnering with the enemy because we always need to have the best of medical experts. And we cannot do the selection. The enemy in the state helps us do the selection. But then, one of the first things that my director, my MD, would ask me when I get to feed him back on this program is, what is in for the company? Like I said, we're a profit organization, so not an NGO. Community services like this come in only when we want to do CSR. And then it's supplemented to that extent because of the philanthropic disposition of my managing director. But when it comes to things like this that he would feel are proposed, suggested, or somewhat imposed on him, no, I will want to impose it on him because I'll have to convince him, brief him and convince him, so it will look imposed. He starts with saying one company does not produce or print money, produce or plug money from trees. What is in for the company? Yes, as a communication expert, brand strategist, I understand the technicalities and benefits of the brand packaging that was mentioned by the doctor and all of those things. But in marketing, to what extent does that bring us profit as a company? That's the next level of consideration. Because even when you want to go on an advertising campaign, you must calculate the goal, what is your achievement, and then how much money, you must compare the cost and what you stand to gain. So that's the question I want to ask. What is in for us? And then for the United States Agency for International Development and the partner organizations here in Nigeria, do we have, by coming into this partnership, do we have the partnership, or will we have the partnership sustained to when we can also propose our own ideas, our own initiatives, our own discoveries? Because one of the things that I brought in after our last medical outreach was that we should begin to have, we are beginning to create a database, where we can take statistics of some of these cases, where some cases are predominant in communities, and then begin to draw attention of people with much more capacity, or people who have their target and interest, focused interest in those areas, to come and tackle them from the root causes and all that. And also I want to suggest that, like the doctor said, we have treatment centers in communities. For Akwa Ibom State, can I have, okay, before I forget please, that video that played, that's what I need most. I don't know how I can get it. Okay. Yeah. That would go a long way in speaking for me, explaining to my management. Then the treatment centers, I don't know if we have a list of them, the communities where they are located. Yes. I think, okay, even if for any reason, we can even convince him to go to his own immediate community, his federal constituency, or somewhere in the host community. For instance, maybe one of the areas where we are being given a new contract in the states as per CSR to the host community. We can find, if you can find 1 or 2 treatment centers around there, we can decide to take that up. Thank you very much.
Tuberculosis that affect us, people are just pushing for us to go into the medical aspect of it. It's, we call it Mycobacterium tuberculosis complex. Now, this bacteria or germ is a slow organism. You've learned also that this organism can stay within you for the rest of your full life. It might not affect you because it is slow, dead, and killing slowly. Now, but if you have good immunity, you will continue. If your immunity goes down, it will come out. Now, yes, there's a species called Mycobacterium tuberculosis bovis that is in cattle. You have those that are in there and all of that. Now, this Mycobacterium tuberculosis complex, there are 7 of them. Now, this one can be gotten through milk. Now, the thing is, don't take unpasteurized milk, untreated milk. Even the meat you eat, the wild animals, if you don't cook your meat well, you will get that, and that's tuberculosis caprese. Okay, so I don't want to go into all of that. You understand now? So, but primarily, Mycobacterium africanum, Mycobacterium tuberculosis, that's the one that when it stays within you, it still wants to go out. And so when you talk, cough, sing, sneeze, you aerosolize it. And as we sit here like this, somebody that has it, as we're sitting here like this, they aerosolize it, we keep breathing and then, yes, and what's that. So those are the primary means of the transmission of tuberculosis.
Thank you.
Thank you.
TB is genetic. Second question is on the treatment. I don't know whether it has been modified now. The medications you see that even sometimes when you interact with the patients, they are even scared of the volume of medication they get. So I do not know whether there has been modification, say for the period that they are subjected to that treatment, say 6 months, right? Is there a way that maybe instead of having that volume of pills that they have to, so that it does not increase the fear, as we are all aware of? Thank you.
Thank you so much.
So, TB is not genetic. My sister already told us that fact. She told us that TB is caused by a germ, a bacteria. She gave it a name, but what we know is that it's a bacteria that causes tuberculosis. And it spreads from person to person when somebody that has the disease coughs out the bacteria, and you inhale that bacteria. So it's not genetic. Then for the pill burden, we have 4 drugs, different types of drugs that have been used for the treatment of drug-susceptible tuberculosis. These 4 types of drugs, in those days, they were giving them like as individual drugs. But just because of the fears people have, the issue of pill burden, they now decided to fix those drugs. A tablet that the person is taking contains 4 of those drugs. Are you getting me? And these drugs are taken according to their weight. For somebody who is about 55 kilogram to 70 kg, that person is expected to take 4 tablets. And each of those tablets contains 4 drugs that are being used to treat TB. So for somebody whose weight is less than 55, that person will take 3. Somebody whose weight is less than 40 kg, that person will take 2. So if you look at it, that person taking 2 tablets is taking each tablet containing 4 of those drugs that are used for treatment of TB. So we have tried as much as possible to make sure that pill burden is not much of a problem to patients. Then coming to what we call drug-resistant tuberculosis, that one initially, the biggest problem we had while treating this patient is because they take a lot of drugs. The injection they will take, the number of tablets they will take, but within a short time, we've been able to come up with a policy where the pill burden for drug-resistant tuberculosis has been reduced drastically so that a patient can conveniently take these drugs without much stress. That's 100%. The main prong of TB control is early diagnosis and prompt treatment of somebody that has this disease. If you diagnose it early and treat promptly, the issue of that individual spreading it to 15, 20 persons will not be there. Are you getting me? And across the states of the federation, that is why you have a state program manager for TB. Then all the local government areas in your state has a TB supervisor that controls the activities of TB in that LGA. Not only that, each of those LGAs have dot centers. What I mean by dot centers is that where you can easily go to and diagnosis and treatment for TB is given to you free. Are you getting me? And if you go to any treatment center or any dot center and you are being asked to pay for these drugs that are being used to treat TB, you raise an alarm. These drugs, particularly for treatment of TB, are supposed to be given to you free. So like in Cross River State, they may have over 400 or 500 treatment centers. And these centers cut across even the teaching hospital to most of the secondary health facilities, the general hospitals, and most of our primary health facilities. You can easily go there and you'll be given medicines for treatment. So though we are saying that TB is a killer disease, it's not as bad as that when you pick it early enough and when you put the person on treatment immediately. So there's no cause for so much alarm.
Let me add yes.
The diagnosis can be difficult, but in most cases, we make the diagnosis, and it will interest you to note that the treatment for pulmonary tuberculosis that affect the lungs and the treatment for extrapulmonary tuberculosis that affects other parts of the body is the same. You use the same type of drugs. But again, it depends. At times, it affects the bone. Instead of you treating for 6 months, you may decide to treat longer than 6 months, maybe up to 1 year. Another interesting thing I will let us know is that since tuberculosis is airborne, and Dr. Bassi has told us the symptoms, most of times people that have tuberculosis diseases, when they cough, the bacilli that causes tuberculosis comes out of this people. And if you are near him, just as we are all here, you are breathing on your own. You understand? Passively, you are taking in the bacilli. Again, you get infected. At that point, you may get infected with tuberculosis. The fact that you are infected with tuberculosis at that point does not mean that you have the diseases. this bacilli that has entered inside of you may just go to a section of the lungs and stay there, waiting for an opportunity for it to manifest as tuberculosis diseases. So you have tuberculosis infection, which most of us sitting here have. Yes, most of us, almost all of us that are sitting here have the infection, but we are being protected by our immunity. But if there is anything that happen to you and compromise your immunity, at that point in time, you come down with the diseases. That is when you start manifesting the symptoms. And in most cases, that is when we look for these people and put them on treatment. The good thing about tuberculosis treatment is that although it's highly infectious, when once you put somebody on tuberculosis treatment, within 2 weeks, some people within 24 hours, they are no more infectious again. So that stigma, that discrimination we associate to people with tuberculosis, I think we also need to look at it too. So this is just what the little I have to add to what my colleague has said. Thank you.
22,000 DOT facilities. That is where they offer TB treatment. And for the private sector, we have over 3,000 private hospitals that offer DOT services in the country. Thank you.